Hey, Jordan.
Doing okay?
Yeah, hanging in there. How are you?
Similar. Yes, hanging in there.
Yeah, that's all we can do right now, I feel like.
Yeah. We've got lots of people in the waiting room, but I'm not gonna let them in until 5:30.
Okay.
Um, I think all of our presenters are bilingual, not that that super matters, but I do think that they all have, or at least two of them have their presentations in English and in Spanish. So I'm gonna
Mhm.
try and figure out if they want me to like do like a shared screen thing or
Mhm.
not. But
Okay.
but yeah. Do you feel okay about doing a language justice piece at the top? I'll kind of welcome people a little.
Yeah.
And then
Yeah, yeah.
turn
Happy to.
Okay.
I'll wait for your cue.
Okay. I'm gonna go to the bathroom real fast.
Okay.
Okay, I'm gonna let people in. Good evening, folks. Thanks so much for being here. It's good to see some familiar faces. Hello, hello. People are starting to roll in, and yeah, thanks so much for being here. People are starting to roll in. I'm gonna invite folks to share in the chat um your name, maybe what city you're calling in from, pronouns, and let's do something real easy. Let's do something, how about something you're looking forward to? All right. So yeah, just inviting folks to share in the chat. Uh, your name, your pronoun, the city you're calling in from, and something you're looking forward to. Great. And oh, here comes Christina. This is great. Wonderful. Thanks for chiming in, folks. Folks are putting in the chat their name, their pronouns, something they're looking forward to, the city they're calling in from. Great to have you all. I'm gonna let one more moment go by, get some of these folks in the waiting room in here. Oh, I love it. People are looking forward to getting outside, to doing some exercise, to get some rest this evening. I love that. All right. Demonstrating at the Capitol. We love to hear that. All right. I'm going to invite Jasmine from Community Language Cooperative to do our language justice piece.
Thank you, Jordan. Hi, everyone. My name is Jasmine. I'm here from the CLC to help facilitate the space of language justice today. Buenas tardes, mi nombre es Yasmín. Estoy aquí de parte de la CLC para ayudar a facilitar un espacio de justicia de lenguaje. So as a part of this, we're going to be activating the simultaneous interpretation function for this meeting. So after I finish giving instructions, we'll turn that on. You will then see a globe pop up at the bottom of your screen that says interpretation or language interpretation. If you're joining us from a cell phone or a tablet, you can find this option on the menu with the three dot menu. And you'll be able to select language interpretation from there. Go ahead and select the language that you would like to listen to the meeting in. If you are bilingual in English and Spanish, then don't worry about doing any of this. Como parte de esta reunión para facilitar un espacio de justicia de lenguaje, vamos a activar la función de interpretación simultánea. En cuanto yo termine de dar estas instrucciones, van a activar esa función y en ese momento van a ver un globo terráqueo en la parte inferior de la pantalla que dice interpretación. Si nos acompaña desde un dispositivo móvil, una tableta, algo así, esta opción se encuentra en el menú con los tres puntitos que dice More o que dice Más. Ahí igual selecciona interpretación y ahí puede seleccionar el idioma en el que le gustaría participar. Si usted es bilingüe en inglés y en español, no se tiene que preocupar por hacer esto. Y por otra parte, puede activar esta función en cuanto terminemos de dar las instrucciones. So just a reminder to please take your time with your words, try to take some pauses and, speak slowly so that I can keep up with you all. And if you're having any issues with the interpretation, you can send me a message on the chat and I'll be happy to help that way. Les recuerdo que por favor hablen un poco más lento, que tomen su tiempo con sus palabras y cualquier cosa que se les ofrezca pueden mandar mensaje por el chat. Thank you all so much. We can go ahead and get started with interpretation. Muchas gracias, ya podemos comenzar.
Thank you so much, Jasmine. I'm pressing start now. So here's your opportunity to select your language of choice. All right. And so great to have all of you here. It's so wonderful. We are so lucky to have interpretation tonight. This particular Spotlight On is recorded in English and Spanish. We'll be able to share the recording with folks who register. So if you have folks who can't be here tonight but who have registered, we're happy to share the recording to those folks. And so that just so you know, so this meeting is being recorded if that impacts how you want to participate today. My name is Jordan Garcia. I use he and his pronouns. I work at the American Friends Service Committee, and this is our monthly, we try to do monthly spotlight on. And this almost every January, we do the spotlight on the Colorado State Legislature, where we invite folks to talk about the bills that they're working on that impact immigrant families and our friends in different movements for justice. We are so lucky to have an incredible group of people here to present about the bills that they're working on. And we are going to actually do a little bit of Q&A after each presentation. So if folks have questions for people who are presenting after each one, you can come off mute and ask a question. And of course, you can use the chat as well. And yeah, so I'm going to to ask people who are just chiming in if they'd like to share in the chat their name, their pronoun, what city they're calling in from, and something you're looking forward to. And I don't say that in order to be tone deaf. I know that we've had a really heavy weekend and that it's been a lot lately. So I am going to invite us to go ahead and take a nice deep breath together because I think that will be helpful for me and possibly helpful for you all too. So I'm just going to take a nice deep breath. And just to express my gratitude for you all being here. And our first speaker tonight is Nicole Loy with the Colorado Organization for Reproductive Rights. I'm sorry, Colorado. You'll have to do it better than me, Nicole. I'm sorry, I'm not breathing enough. But I will hand it
Absolutely.
over to you, Nicole.
No worries. Um, Thank you so much. And am I able to share my presentation or did you want me to just share it in the chat?
I was going to see if you would like to ask to share, and then I will grant it.
Okay, perfect.
Perfect. There we go.
Hey, good evening, everybody. Thank you so much for being here tonight and for listening to my spiel. I hope you're seeing the correct desktop. Is it a presentation that says protect our affordability programs?
Yes.
Okay, perfect. So hi everybody. My name is Nicole Cervera Loy. I am the Senior Policy Manager at the Colorado Organization for Latina Opportunity and Reproductive Rights. You were very close, Jordan. Um, it's a bit of a mouthful, but what it really means is that we get to work on a lot of different aspects within our community that supports Latina opportunity and growth, reproductive rights and justice. And that is what I'm going to talk to you about today is reproductive justice. Part of that includes making sure that folks have healthy lives and are able to give birth in a relatively healthy manner. So I'm going to focus on talking about our affordability programs and where we are right now in terms of the legislative session that just began January 14th. So just a brief overview, there have been healthcare decisions that have been moving since the special session last year, where we needed to find an overall fix or temporary measure to protect as many community members that were going to be impacted by the loss of coverage. OmniSalud, for folks that don't know, it provides healthcare coverage for low-income immigrant Coloradans. Although it is focused on the immigrant population, this essentially also is a program considered a catch-all for any folks that cannot access insurance through the regular marketplace or Medicaid. This specific program that I'm going to be talking about is one of the affordability programs that we're watching this legislative session and that we're working right now to be able to get a bill forward to continue the funding for the program. It lives under the Health Insurance Affordability Enterprise. I'm going to be using their initials HIAE, HIAE, a lot, but that's what it stands for. So right now, policymakers are starting to discuss how the bill is going to turn out. There is no bill language at this time and no final decision about the way to move forward. And so right now, community input is more powerful than ever. So what has changed? In 2025, the OmniSalud program was able to have a total of 12,000 slots available, which were filled within 7 days. They they were gone before you could blink. I don't know what happened. And then after the 2025 general legislative session, we were not able to secure additional funding necessary for the program to continue at the 12,000 slots available. We were expected to get down to 2,000 slots. And that was going to be the reality until special session in August. We were able to work together. And when I say we, I'm talking about advocate organizations. We're able to work together with stakeholders and legislators to pass a law during the special session to cover additional funding for the program. It was not enough, but it was enough to sustain the program for another year. Unfortunately, there were significant cuts that had to be made so the program could continue. So in 2026, for the 2026 plan year, after the special session in August, the slots instead of 2,000 were up to 6,700. So we were able to successfully get, and I need to charge my laptop. We were able to successfully get an additional 4,000 slots that would not have happened if we weren't able to pass that bill during special session. But it created a lot of uncertainty. It created a lottery system, essentially. That was the only way that they could fairly distribute the available number of slots. It left 5,000 people without coverage. It was confusing for many folks, and no new folks were able to get into the program at all. And so what this meant also is that on top of those coverage slot changes, there was also cost changes. So in 2026, families only paid 10% of their care costs because of this program. But after the special session, we had to pass that bill, be able to get temporary measures, and now families have to pay 26% of their care costs. That's double what they had to pay last year, an expense that many did not really see coming. So that's where we're at right now legislatively. What this means for you guys and what this means for the community right now, especially because we don't have any bill language, is that we really want to make sure to center the community experience to make the decision makers understand the very real impact of what the loss of these programs means to them. So Color right now is working to collect community stories in order to guide our advocacy through a community lens. We want to get talking to folks and kind of ask the questions how folks felt if they lost coverage or if they were afraid of losing it, how the lottery or the reduced amount of slots impacted your family, what legislators need to understand about losing care or about paying more, whether marketplace insurance was affordable, what should never change about access to care. What I really want to dig into for legislators is that community has given enough. Community does not need to continue to sacrifice for their affordability programs to continue. What there needs to be is an equal amount of give, right? Because the community already gave 5,000 slots. They gave the fact that they didn't have to pay for care before, and now they do. And now insurance carriers, hospitals are saying, I don't want to pay. I don't want to pay more fees. I don't want to do anything else. And so it's very important to take this time where there is no bill language, there is nothing set in stone, to really start pushing on them about how this is really impacting our communities and how community has done more than enough to be able to be, quote unquote, deserving of access to healthcare. On top of this, we also have Cover All Coloradans, that's under Medicaid, and the Reproductive Health Care Program, also under Medicaid. Both of those are being impacted by the budget right now. So we have 3 total affordability programs that have helped our communities greatly, have helped Colorado greatly, that are in danger. The governor's budget focused specifically on Cover All Coloradans and on the Reproductive Health Care Program, and tried to say that that's the problem, you know? And so we're fighting an uphill battle, making sure that there's no more cuts or unnecessary cuts to the budget regarding Cover All Coloradans. And then we're fighting on the other side, on the insurance side, to make sure that the marketplace continues to remain equitable for Coloradans. That was a lot. But I really tried to synthesize a lot of information, and I hope it was understandable. But please, if you have any questions, please feel free to put them in the chat.
Yeah, actually, I have a question, Nicole, if it's okay. Um, I think my question is, it, it's kind of like how friendly do you feel like the state legislature is right now to this particular bill? Does it feel like a ripe kind of environment for a bill like this?
It's complicated because normally I feel like it would be a very easy issue for folks, but after the federal elections and after the reality started to hit that we had to pay more, there were changes in support for this bill. So in 2025, for example, we didn't have um, all Democratic support. You know, we had some really key players that were really great, and then we had other ones that were not really great. And then we had the other aisle, of course, that also disagreed with this just in its premise. So I've noticed that it's become a conversation where like Omni Salud isn't directly being mentioned, right? It's like an overall encompassing about um, the programs that are going to be impacted. We're not talking about, we're not trying to focus on a specific population, and so it's. I feel like it's tentative and it changes ever so often. The biggest issue right now is that essentially what we've been told is that the legislature does not like the idea of fees. That's probably the easiest way to get more money, because it would be fees on insurance carriers or hospitals or something like that. But that was like officially no go. So right now we don't have a funding measure. There's no, this is where the bucket it's going to come from. So because of that, there may be kind of movement we could do. Our hope is that they feel so overwhelmed by community talking to them that they are like, yes, we need to fix it, whatever it takes. Even if that may seem a little optimistic.
Yeah, I see. Okay. Thank you so much, Nicole. That, yeah, Cappy's right. That's very clear. Does anyone have any questions for Nicole? Things you'd like to, oh, it looks like we've got one in the chat from Lena. Do you want to just come off mute and share it?
Sure. Hey, I'm a nurse in Denver, just trying to learn a little bit more about the world that I work in, but don't know that much about. And I'm wondering how many people would actually qualify for Omni Salud if it wasn't a program that was capped at a certain number of participants. And I guess a sub question is, am I understanding right? Omni Salud is it considered health insurance or is it considered a discount program? Thanks.
Yeah. So essentially, it's an insurance program that exists under Connect for Health. Omni Salud is just one kind of like menu of options that they have. Is what we're really looking at is the Silver Enhanced Savings Plan, if we want to get really technical. But yeah, Omni Salud is just part of the insurance program that allows folks to input their information and apply for insurance programs through that kind of additional door that was created within Connect for Health for folks that wanted to have data privacy concerns. And so that's kind of what Omni Salud is. It's kind of living under an umbrella of Connect for Health. It's not its own insurance plan. It's more like an umbrella that encompasses plans for folks. And how many people would qualify? I believe it's based on the federal poverty level. I don't know the exact number, I won't lie, but I would definitely love to get that number. And our hope also is with the slot issue, is that when this program started in 2022, we had 10,000 slots. And then, as I mentioned, in 2025, we were up to 12,000. So that took us 5 years to get up 2,000 slots. And now we're at 6,700. And that's the starting point of the conversation. It's from 6,700. So yeah, great question. I wish I had the exact numbers. I'm sure I can find them in the old notes from when we passed the bill originally. But think probably around 100, those folks that are like 100% under federal poverty levels. How can we help? Stories. Basically, right now, what we're really trying to do is reach out to our legislators. Color is having a La Plaza event on Thursday to help some more community members just know and be aware of our priorities and why these programs matter. And yeah, so it's just reach out as much as you can to Jordan, to people that you trust. Reach out to folks that you know might be impacted by this. I feel like right now we're at a key moment to really start building that community connection and intentionality before heading to the legislature and just focusing on trying to take as many stories as we can, right? I feel like right now we're at a very good time where we can really be intentional about how we collect stories and how we put that information forward. Yes, for the data protection on Coverall. So it's not on Coverall, but just real quick on the data protection issues that have come up. It's under our emergency Medicaid program. And so our emergency Medicaid program kind of houses a bunch of opportunities for folks, including actually our reproductive healthcare program that allows folks access to contraceptives, cancer screenings, and things like that. So, and it also is something as simple as folks using it when they go to the emergency room. So DHS submitted an ask to CMS. CMS then submitted an ask to us. A bunch of states went for a lawsuit. There was an injunction. The injunction basically said, no, you can't share citizen information. No, you can't share this aspect of it, but we can re-up information and pass it over as long as we can cover most of our bases. We don't know what that information looks like. We talked to HCPF, and again, when I say we, I'm talking myself and other advocates, talked to HCPF, and they let us know that folks impacted were over the age of 19, only in emergency Medicaid, and they had their cases re-upped for CMS review, essentially. So basically it's not like, let's say they are taking information that they shouldn't have. This is information that CMS already has, but that they then are kind of highlighting for DHS and saying, these are the folks where we think these cases are a little bit maybe weird. And so that's what happened with that. The latest update is that HCPF has not released any communications on this, either to the public or to folks that were impacted. And it's not looking like that's changing readily anytime soon. They really want to rely on advocates to give this information to community. Okay. I think that's all the questions in the chat.
I think you are right. Last call for any questions for Nicole. And thank you so much, Nicole, for putting your email address in the chat. When I send out the recording for this spotlight on, I'll include a one-pager from Nicole.
My sound turned off.
And oh, sorry, did we have someone who wanted to ask a question? Go ahead. Oh. Okay, maybe we don't. So yeah, so if you have other questions for Nicole, you can absolutely reach out to email her. And I will send out her email address with her permission and a one-pager to this group of people who have registered for this training. Yeah, thank you so much, Nicole. I am going to go ahead and pass it over to Lamine with the Colorado People's Alliance to speak about the bill that many of us are very curious about, thinking of it as kind of a big bill. Lamine, are you there?
Thank you, Jordan. Hello, everybody. I'm sorry, I'm still driving, but I'm here and present.
Oh,
Um,
Lamine, we can
I
have someone from Juntos go first. It's
okay.
okay.
Yes, yes.
Yeah,
If they can go, I should be parking in like 5 minutes.
sure, no problem, no problem.
Thank you.
Karina, would you be interested in going next, or also Thomas from Together Colorado could go next too?
We can I can go.
Great, I'm
Can
gonna
I
start.
share
Yeah,
my screen?
yes.
Mm,
And Karina Hernandez is with Juntos Colorado, or right, Juntos Colorado,
mhm.
and we
Juntos Community.
community, excuse me, Juntos Community, and yeah, there you go. Thank you so much for being here, Karina.
Okay, amazing. Thank you so much. You can see my screen, correct? Like
Yes,
in presentation mode.
yes.
Okay, great. Hi everyone. My name is Karina. I use she, her pronouns, and I'm on the steering committee this year with Juntos Community, and I am joined alongside my colleague Ginny. Oops, will it go?
Hello, I'm here.
Awesome. Okay. So, if you are unfamiliar with Juntos Community, they are a nonprofit organization focused on advocacy in the undocumented community. Specifically, they focus on doing DACA renewal workshops for folks, as well as workshops tailored for folks who do not have a social security number. With that in mind, we have done a lot of community outreach within the last couple years in terms of really asking the community what is needed for folks to truly live healthy and safe lives, specifically when it comes to upward economic mobility. Um, so for the last 10 years, especially in Colorado, there have been a lot of upward movements towards gearing folks who are undocumented to be able to pursue higher education and therefore get different jobs as a result of that. Well, within the last 10 years, right, the majority population that we focused on was DACA. Why? Because that was the age group that were DACA recipients and that were seen going through high school and then for college. Well, DACA, for a number of reasons, is phasing out in terms of folks who are eligible and are in like school-based age. Um, a few reasons why. One, there was a federal injunction that stopped new applications from being reviewed, but also there are limits in terms of who was eligible, um, meaning like when folks came to the United States and how old they were, et cetera. So because of that, there are a lot of folks now that are either in high school or in college who do not have some sort of temporary protection like TPS or DACA. As a result, what we did is we wanted to focus legislation that focus on professional pathways through entrepreneurship and independent contracting with our bill. So before I move on, I would love to invite Ginny to talk about her personal testimony and really how we got to this point.
Hello, everybody. My name is Ginny Calderon, and I am here today with Juntos, but also I'm part of AFFC. I know Jordan for a while now, so hello, everybody. And basically, hey, I see Whitney too. So hello, guys. It was a really big journey to complete my education because at the moment to apply for these programs, usually they require to have a background because the clinical part have to be obviously in a hospital or a clinical. And unfortunately, they require a social security number. So I was denied to complete my certification on Emily Griffith. Is when I been part with Juntos because Josh helped me to find why they are why they were denying me. If they don't really wanna run my background with my IT number, no matter. However, there's another different ways to run a background, but they denied. Finally, I found a different school, and I was able, after knock a lot of doors, I was able to get my certification now in December. So I complete my education on CNA. But honestly, I think this campaign is really important because behind me, it's a lot of people who deserve to have education. These states deserve to have more professionals working on health. We are in need of this. So to me, it's important to we open this door and try to find more supporters to open this door for what our states needs, you know? So I'm not sure if you have any question about how I do all this journey, but I will be here. Thank you so much for listening, and I know que sí se puede, so thank you.
Thank you so much, Ginny. Yeah, and to really echo off of that story, right? The whole reason why folks like Ginny are really motivated to complete their certifications is because of legislation that was already passed in 2021. Senate Bill 2177 and Senate Bill 199 conjunctively allow for folks to be able to get their professional certifications. So things like their nursing degree or their nursing license, their CNA license, et cetera, at the state level, without a social security number. So where we're finding gaps right now is that folks are able to do the end portion, right, to get their certification without a social security number, but they're not able to complete the middle part, which is the clinical hours or the teaching hours that are needed for the completion of the degree. There we go. So the safety not status campaign, we don't have a bill number yet, but our sponsors for this bill are Representative Ricks and Representative Joseph, as well as Senator Wiseman. The focus of this bill is that for any non-employment opportunity that requires a social security number for a background check, an ITIN must also be allowed. Like we did a lot of research. I actually did my capstone for my master's in public health, specifically around nursing programs and clinical placements. And really tried to find the information as to why social security numbers are needed for the clinical hour portion of it. And what I found is that the answers are not aligned and that they're not that it varies, right? Major hospital systems, from what I've seen, is that they ask social security numbers because their programming already does that for employees. So they use the same system for everyone, which we know that they shouldn't or don't need to because folks are being employed. Clinical students and nursing students are not getting paid for their time in the hospital. They are students. And that doesn't align with other programs that are 100% able to do it and able to find or run those background checks without the social security number, and more importantly, without compromising the program and the safety of the program. So we do plan to introduce this bill by the 30th of January, and then for it to be heard in committee. And what we ask folks to do, especially in the community, is that we do have a petition that you could sign. The use of this petition is really so we can show during committee hearings the amount of people that are supportive of our work, because we know that our work is important and necessary for folks to be able to live the lives that they want to live with the jobs that they want to work. So signing that petition would be amazing, as well as if you are part of an organization and your organization or business wants to sign on. I will put the email in the chat. You could send that endorsement to Josh. That would help us out a ton. Most importantly, testifying in person during committee as either yourself or as part of an organization, or if you are an expert in anything and everything regarding business, or background check vendors. Like if you work with a background check vendor, we would 100% be open to hearing your side of things as well as getting your testimony at the Capitol. And a part of there is a large portion of our community that has a lot of testimony and is really wanting to share their stories. However, given the current political climate, do not feel safe doing so in person. So we are asking for volunteers, for folks to read someone else's testimony. Again, we would 100% appreciate yours, but if you would also like to read someone else's or just read someone else's, please let us know. We would be more than happy to have you help. And here are our QR codes. And that's all for me, other than the questions.
Thank you so much, Karina. Yeah, I will love to take this slide and put those links in our notes out that'll go out to people after this too. So thank you for that. And yeah, just inviting folks if they have questions for Karina about the bill that Juntos Community is putting forward. Yeah. Do you all offer like prep for a testimony? If
Yes.
you've never done it before? Great.
Yes, thank you so much for that question. If you've never done it before or it feels a little daunting, we definitely have prep that we can work with you to work out your testimony, talk it out, and walk you through the steps of what that looks like.
Awesome. Hey, do other folks have questions for Karina about this bill?
I'm just wondering, thank you for being on here and thank you to everyone presenting tonight. I'm just wondering, are you collaborating with other organizations on this as well?
We do have a coalition of folks who signed on, but running the bill is primarily legals.
Thank you.
I have a question if I go. Oh, sorry, I can wait, Jordan.
Oh, I was just going to say the organizational sign-on might be handy for Linda then too. Yeah. But go ahead, Lena.
I'm just curious, are there any healthcare organizations that are signing on for this?
So right now, no. But there is a lot of misinformation in terms, and I think like truthfully, not just misinformation, but staying on the conservative side, given the political climate of what it looks like, right? Because I know I could tell you firsthand from doing my capstone for my master's program, I read that federal code, I read the Medicaid code, I looked for anything and everything that could cause problems, especially for students, right? That are in hospitals, participating in the clinical programs that are Medicaid, Medicare insured. And from what I've read, there is not a single word in there that prohibits that. The people who need to be insured, who have to have social security numbers because they're employed at the hospital, are the physicians, the doctors, and the hospital itself, but not, well, the hospital doesn't need a social security number, but the hospital has to be accredited for Medicaid, and so does the doctor, but the students do not. So I think that there is fear around that, and there is a lot of there's a conservative mindset of what that looks like, but we know that it's been done at other clinical sites. It's just getting folks aligned. So we're really working hard and relying on these community connections to get health organizations on board. Elizabeth, so wondering if senior and disability groups are signing on given the workforce shortage in home care. We haven't as of this point, but if you do have connections, we would 100% love that, because I also focus that on my capstone, is that the major shortages that we're seeing are at-home health aides, especially like we're seeing a nursing shortage, and those jobs can be done, especially like at-home care as independent contracting. So yes, if you have any ideas or connections, I'm gonna drop the email below. It'll be my email as well as Josh, who is our advocacy manager. Please feel free to email us.
Awesome. Thank you so much, Karina. This is great. I think a lot of people here on this call probably have really great connections with folks all over the state, but especially here in Denver and Aurora. And so, yeah, we would love to try to get some of those organizations connected with you all with the coalition. All right. Any last questions for Karina? Or Ginny? You can ask Ginny anything you want to. Awesome. Well, maybe we'll see you at the Capitol. Great. I'm gonna see if Lamine, if you'd be interested in sharing about the bill now that you're home.
Hello. Yes, I apologize. I'm still on the road, so I'm in a parking lot so I can join. No, this is good though, Jordan. I knew it was gonna be like this, but I didn't want to miss the meeting. Um, yes, my name is Lamin. I'm the lead organizer at Colorado People's Alliance, and I'm also in charge of our immigrant justice work. And proud to be also affiliated with AFSC, CERC. You know, we all work together in this important work that we do. So I see Juntos here in Color. I mean, yeah, so it's beautiful to see familiar organizations and faces. I was talking to Jean Demler earlier today. She was planning to be in this meeting but couldn't make it. So she's like, can you since you're gonna be there, that's good. Yeah, we've been coordinating a little bit. Anyway, I wanted to touch on the coalition work that CERC and COPA have led together last season and re-leading again together this season with the participation of the organizations that I've mentioned and others. And so, especially with the current climate we live in, we're trying to do the max we work with the mapping of the power that exists in the country. So, in terms of federal work, we know how limited state, local um, policy is in terms of what's happening federally. But at the same time, we're trying to do the maximum possible in our power as a people, but also hold a co-governing power with those we elected in positions to do so. So with that, if you all remember last year, CERC and COPA worked together, and over 150 organizations signed on to support the passing of Senate Bill 25276, which expanded protections of people's information, which then made sure that immigrants were not targeted separately to violate their rights. And so, I mean, AFSC, all these organizations were involved in terms of, if y'all remember, some of you who were at the Capitol when we were all white shirts and showed up in solidarity, and we had those late nights and late evenings of testimony from from the beginning to the end, and it was a fight because it was a very messy year in terms of the Capitol. But our coalition work and our people power building really made that bill come through. However, there are some things we could not accomplish because of some stripping of the bill. And part of that, if you all remember, the all public institutions, many public institutions were required to have policies like explaining how they protect people's information, and also how an individual who works for an entity, if they violate the law, we can pursue them. And so we saw how that happened when it happened, I believe, in Mesa. My brain's all over the place. Okay, Mesa. And the officer just quit or resigned, and then that was the end of the story. And so we could not really hold him accountable. And so this year, there is a package bill, what we're calling package bill. Um, and it's still in, part of it is already introduced, but it's still in the works behind the scenes. So, like, uh, I've been only sharing it in internal spaces such as these for the fact sheet on it. Um, and so the way we're trying to do is expand the protections that exist in the SB 25276, basically the liability in 276 from the employee to the employer, right? And also all subpoenas that are received from the DHS will be reported appropriately, and make sure there's a task force that's working the transparency. Um, in the transparency when local law enforcement is deputized to work with federal agencies. All right, so it's a lot of it's a lot of limitations of power and where they are limited in terms of power mapping, like what role you can play, especially when ICE is involved. We know a part of it last year when it was passed was that when someone is released from uh, bail for any reason, it might be just for got in an argument with a police officer and then ended up in jail and then got bailed out and then they were holding them for ICE just because they could not verify their identity and their documentation, which completely is illegal based on this bill. And so we want to make sure this year those rights are still afforded to folks. Again, immigrant detention facilities shall provide yearly reports to CDPHE and on the outcome of pregnancies, chronic health, anything really that happens to inmates that are, well, not inmates, but individuals that are held in behind cells because they're immigrants. And so on top of that, there was another bill that Senator Wiseman and Senators Wyman, Jode, and also Representatives Froelich and Zokai were working on, which is government accountability and trust in law enforcement, which basically says that if um, if law enforcement from Colorado or another state working for on behalf of local, state, and federal law enforcement agencies shall not wear any facial covering. So basically, it's a demasking bill, right? Unmasking bill, which says that if you are working for the state or any other state, you cannot um, mask up. You have to be able to identify yourself physically and also by your vehicle that you use. Something you have to be a person has to be able to identify you and what you do. And so with that, Senator Wiseman and Representative Zakai and Mabry had added cause of action, which means it gives you a constitutional right that apply to all persons. While immigration policy is federally controlled, Colorado retains sovereign authority to regulate conduct within its borderlines. So a person whose rights are violated basically um, can file a lawsuit or go after, or you file a complaint against the entity that violated their right. And so that's the third part of this package, and then with it is a fourth part, which is not really a law but a statement, and to really see where our elected officials stand in terms of these issues, and that is the immigrant rights resolution, right? And so that is going to be introduced by Senator Jode, and Color and Copa worked on writing the resolution together, and basically it's saying that we asking our representatives and senators to call out the federal government on the violations of human rights that they're practicing right now, especially with ICE, right? And so it's not a law, but it's a start to the limit within the limitations we are in the power that we hold as a state and as local authorities and local people power. Yes, and so with that, CERC has been doing a lot of education on the SB 276 bill, and we're working on this bill again together. And COPA and CERC have now, starting today, started bringing our two different member committees to talk about this session and to plan together and to coordinate together, right? Which is very powerful because usually we meet with our members separately. And so, as you saw, like Jordan brought folks in here to talk to you guys about what's going on during this session. So, we're really maintaining the strength we built from the coalition last year and using that as a strength in the separate spaces that the individual organizations work in. All right. And so, with that, on February 2nd, which is Monday at 11:30, we will be holding a press conference at the Capitol West Steps. And this press conference is basically to launch us off with these bills, with the senators and the representatives present. COPA and CERC members will be there, and then we asked Gene Demler to do kind of a grounding exercise for us, maybe a poem, maybe just something to ground us as a community in at the end of the press conference before we take questions from press. Um, I think I have covered in the best way possible that I can, the many details in as little time as I can. Hopefully, that's clear, and I'm open to answering any questions if I may be able to answer them.
Yes, thank you so much, Lamine. Yeah, Anne asked in the chat about the press conference. It is at noon on Monday on the West Steps. Oh, excuse me.
It's 11:30. So originally we had planned for noon, but we got the space booked for 11:15, I believe, and the we agreed today to go ahead and start at 11:30. Um, I we already have a flyer that I will share with Jordan to send to you all by email, because we've been sharing it by word of mouth, but because we were figuring out exact timing, I didn't want to send a flyer that would need to be then edited later. So tonight the flyer will go out to everybody.
That's perfect. Awesome. Thank you.
Has there been consideration of having the Colorado Attorney General's office conduct inspection of geo and produce reports? Okay. Yeah. So thankfully, the AG's office is very supportive of us, of our work in the immigration space. Um, and CDPH has not really done everything that it can, but let me see. Has there been consideration of having the Colorado General of Conduct? Yeah, conduct inspections. We haven't talked about it. I mean, I think maybe with shutdown Geo, Jordan might be able to answer that question better because they've had more communication there. But I all we know is like we're not getting what it was meant to do, especially now with the looking of opening more facilities. Part of the bills that we're introducing actually, well, the SB 270, part of the expansion is to introduce some restrictions that we can put in place for these newer places, basically to have a hard time functioning. Again, that's with considering that we know we are limited in terms of what federal authorities can do. But we're trying to get our legislators in the practice of doing the max that they're allowed to do and the max that they can do.
Yeah, I mean, it says that in the protect safety of individuals who are immigrants part of your fact sheet, it says CDPHE will conduct regular environmental and health inspections of existing and new immigration detention facilities as the facility's expense, at the facility's expense.
Yes.
So it is tucked in there, but we can certainly like work with the sponsors to kind of put some particular teeth into it. But I think the answer to the question, Lindsay, is yes, it's tucked in there, and we probably still need to work on the details.
Yeah, that's what I'm saying. Like we talked about it to have it in there, but it's just knowing that how hard last year it was just to get this bill through for many, many different reasons that we don't need to get into. But this year we made sure that we put everything we want in there, and then we haven't talked about um how we would negotiate when things get hard to get this bill through. But however, everybody on the coalition wanted to put the max power, the max request in this bill.
Yeah. Maureen has a good question in the chat that I don't actually know. So is it possible to prohibit local law enforcement from being deputized to work with federal agencies in this bill?
I'm not sure if I can answer that question, but I can get back to you on it. I know there's been some suggestions that were made. For example, somebody suggested that we look at expanding the warrants to like vehicles, right? A vehicle being an extension of a home. So I know the legislators are open to hearing feedback. While because as bills get introduced, they'll be amended based on for different reasons. So it is something I can ask. I know though part of the expansion of the SB 276 is also to restrict um, local law enforcement from overstepping their boundaries.
So is it okay if
Yeah.
so I don't know much about any of this, but there's those 287G agreements that local law enforcement can enter into with federal agencies, ICE, and then the feds pay the police officer's salary. They're called 287Gs? And I noticed on the ICE website that there were certain states where it said those states, the police couldn't enter into those agreements, but Colorado wasn't listed as one of those states. So I'm just wondering if language around prohibiting 287G agreements would be helpful. But I don't know enough about any of
Maureen,
this.
that's a great comment. And I'm gonna take note of it and pass it on. Because that was a discussion in terms of, because SB 276 mentions it. You can't, if they violate the state limitations, they can be sued, and the AG can go after them, right? They cannot work with federal agency. They cannot work with ICE. Local law enforcement cannot do that. We have a law that says that. We have a different law than 276 that says it, but 276 insisted on it, right? Especially in terms of what happened in Mesa, where actually it was recently. There's a different one where the student that was pulled over, by a police officer, and then that police officer reported them to ICE, and then ICE picked them up shortly after. A student who was just heading to school, right? So, but that we have laws that say Colorado law enforcement cannot do that, right? And even when during session last year, there were arguments by some sheriffs who were saying, well, when an individual commits a crime, this and that, but no matter what, and when an individual commits a crime, there are laws in place to be followed in that process. That's for everybody. That's just a way of distracting people from actually what they're intending to do.
Yeah.
Great question.
Okay, good.
Does anyone else have any other questions for Lamine about this bill? Oh, can you put the name of the law? I believe right now it's kind of generally being called the Immigration Package Bill.
Yeah. So Jordan, I've been waiting to get the final wording that's agreed on before I share it openly, but I feel like it's up to you. If you think we can share the one we have from IRT in here, but it's just that we're not sharing this out until the actual bill language comes out. It's just like we've been sharing in spaces like this just for people to get an understanding of the packaging we want to do. Basically, since they're all tied to one another, they're separate bills, but they're all tied to one another. We want to carry them together. There are other bills, like for example, the bill that Nicole talked about, and the bill that Karen, I think, is it Karen, talked about. Those touch on immigration, right? But they're not direct. They're not direct bills for immigration law. Excuse me. And so yeah, COPA will be probably participating in those other bills at different levels.
Go ahead, Barbara.
Yes, I'm not sure. I've been hearing this rumor about this Proposition 95. How is that such a thing, and how is it going to impact with what we've already got with 276? Does that make sense, Jordan? Or Lamine?
Lamine, can you share a little more?
Well, I'm hearing that this Proposition 95 that's supposedly going to be on the ballot goes against what 276 is saying, that we want law enforcement to cooperate with ICE. Is that correct? Am I hearing things?
Yeah, so basically we will, I heard about this from our team at the Capitol. We will be hearing about, like, this happened last year too, right? There will be bills that are completely against what we're trying to do. And basically we will be communicating with everybody to come and fight those bills. And last year there were two bills that were introduced. I don't have official bill languages yet because folks are still finalizing bills. There are some that were introduced already, but I'm still getting familiar with the bills. But I know any bill that comes and goes against this work, it's going to be the same process as last year. We're going to rally the same folks to come and testify against those bills and kill them in the committee. And that's what we did last year.
Thank you.
Am I missing any other questions, Jordan?
I think just the question that will all these bills be sent in a follow-up email with one-pagers? And yes, they will be.
Yes, yes. So you know how you give it to one person, that person gives it to another person. We've been avoiding that until we have the concrete final of everything, right? But this is a trusted group, a trusted circle. I respect AFSC a lot. And actually, on February 2nd at the Capitol, when we do the press conference, we have allotted time for AFSC to speak, and it might be Jordan. So yeah, the amazing work that's done in Corn and in the organization supports everything we're doing last season, this season, and going forward. So there's a lot of time for AFSC to speak because I mean we're doing the policy work, but y'all are doing the toughest part of the work, along with CERC and all the organizations and individuals involved in volunteering.
Thank you so much, Lamine. This is great. We're doing awesome. We are very, I guess I want to say really explicitly, like we're very lucky in the state of Colorado to have a really great movement that collaborates really well together. So, Linda has a question what's the best way to keep track of dates to testify? On all these policies? That's such a good question. I would say, especially for the Karina and Juntos and with Nicole's with Color, I think probably emailing them directly and trying to kind of just be like, hey, I'm interested in testifying. Can you keep me abreast of dates? And I think they should do that individually with those bills. And then with the immigration bigger package bill, it's probably going to be all over the place. But if you let us know that you're interested in testifying, we will try to be in touch with you. Cool. Great. I believe our last speaker this evening is Tomas from Together Colorado to share a little bit about the flock bill and the work that you all are doing on that bill, which we know will affect many communities. But yeah, please.
Thanks, Jordan, AFSC family and extended family and all the above. Sorry, folks, I feel like I'm in witness protection program hiding from my children in my minivan. Good to see some familiar faces. And just a friendly amendment to kind of what Lamine shared, to be clear, the Proposition 95 that I believe Barbara mentioned, at least as far as our understanding is, it's qualified for the ballot. It would be on the ballot in November, and it may be an all hands on deck effort to actually defeat what Michael Fields and the Advanced Colorado people have iterated the latest way to roll back some of the things Colorado has done. And so that's a thing I think to keep in mind. And there's still a lot we can do this legislative session. And certainly celebrate the work others have shared. I think we're going to be participating in a lot of that work however we can. Together Colorado is a statewide organization of primarily faith institutions, but also other institutions, schools, community groups. And from the in-state tuition fights, what was that, 12 or 15 years ago, to iDrive and in-state or driver's license fights 10 years ago. My timing may be off. We've certainly welcomed the opportunities to partner with many of the groups on this call over the years in intense ways and in big fights and in off years too. But certainly this year, there's a lot of opportunity and urgency in the immigrant justice space. The thing that we're highlighting that we think can complement some of the other work here is, and I'm just going to apologize in advance, I did not come up with, first of all, we're not at the center of this bill. We're not driving it like others are. So my ability to answer questions will be a little light. But at the same time, the acronym for this bill is my least favorite Easter candy. So I'm going to talk to you about a bill called PEEPS, the PEEPS bill. Can I share my screen, Jordan? Is that possible for a second? I can, it looks like. Here's are a couple of slides. I can share these and make them available. This is an effort led by Senator Judy Amable, and she's got some friends working with this on her. It was supposed to be introduced last Friday. It has yet to be introduced, so that's why it does not have a bill number. And PEEPS stands for, oh, I don't even have it listed here. It stands for, oh, I have to look that up in a second. But it's protecting are something or other from law enforcement, from police over. Anyway, I'm gonna have to define PEEPS in a second, but for those fans of race class narrative, here's a little bit of our race class narrative. We believe in the infinite worth of every person and a justice system that protects human dignity, not surveillance that violates it. Across Colorado, surveillance cameras operated by companies like Flock, boo, are tracking our movements without accountability, threatening immigrants, women seeking healthcare, and families simply living their lives. Flock is the largest company doing this at the moment, but no one knows how these cameras are being used. Surveillance cameras take pictures of every car that passes, and AI creates searchable databases for law enforcement. While police claim they only track license plates and vehicle details, Flock's patent reveals that the technology can track people by race, gender, and clothing. These cameras differ from spotlight or speeding cameras, which capture images only when probable cause exists, and they do not create a searchable database. Don't worry, it's only 2 slides. So here's what the PEEPS Flock surveillance bill would do. Well, first of all, these systems have so far been misused in a lot of dangerous ways. For example, Flock ran a secret pilot program with U.S. Customs and Border Protection with audit logs showing searches for immigration enforcement purposes. Women's health care. Cameras have tracked women seeking private medical care, including reproductive care. In data breaches, Flock cameras have also been found streaming publicly on the internet. In Douglas County, they had a Flock camera pointed at a playground, just streaming all the time what was going on at the playground. So the PEEPS bill, and like I said, I need to look up exactly what this means in a second. The PEEPS bill will protect human dignity by requiring accountability and oversight, limiting who can address the database, requiring probable cause or a warrant, except in certain exigent circumstances, and it would require each search to list a reason and a case number. So instead of this open database, which is like open AI, whatever, and up until now, up until this bill, law enforcement all over the country could access every database in Colorado. A few cities like Denver have made some limited changes to who has access to their data, but there's another 99 cities and counties in Colorado that have made, to our understanding, 0 concessions. So without accountability and transparency, this powerful tool for law enforcement could be abused at the detriment for public safety. Immigrants are being tracked while working, taking children to school, going to worship, buying groceries. Women don't feel safe going to medical appointments. Residents have no control over how surveillance data is used against them. So this is one effort, an effort that we think is really important. Won't solve all the world's problems, but we think an important way to require companies like Flock to protect our data, essentially. So it has yet to be introduced. Allegedly, Senator Mobley has bipartisan support for this effort. And the last thing I'll say before opening up to questions is we think it's actually super complementary. Who here is in any city that has a Flock camera? Actually, looking at the call, I guarantee you every one of your cities probably has a Flock contract. And so great local organizing opportunity around talking to your city council, your city manager, your police department to say, hey, do we have Flock? Have we put any restrictions on it? Some cities have. A couple cities have actually canceled these contracts, which is awesome. And we think it's a great opportunity. If you've got folks in your community saying, what can we do to help stand with our immigrant siblings right now? If going to the Capitol ain't your thing, going to your local city or county and saying, what are we going to do about this? Can we borrow the best practices? We're coming up with some tools that are best practice tools, or at least questions to ask. How can we borrow from what Denver did very imperfectly, and implement that in our community, in Boulder, in Fort Collins, in Pueblo, or wherever in between? We think that's one way to help advance this cause and help protect all of our safety from surveillance. So I think I'll stop there and pause for any questions while I look up what the heck PEEP means.
It's protecting everyone from excessive police surveillance.
Amen. Thank you so much. We do have a bill draft. Is that did you put that in there, Jordan? If you did, thank you. And happy for any questions.
Yeah, and actually, Lindsay dropped in the chat also. If you wonder where the flock cameras are, this crowdsourced map, which is nationwide, is helpful to see if deflock.me.
Thank you, Lindsay.
I just want to thank you for bringing up city council, because I think a lot of people underestimate the impact and sort of, the effectiveness and power that you can have in going to your own city council and speaking up on these issues, and ultimately connecting them to all the issues that we're having around the world, because these types of cameras and surveillance affects my people in Palestine in the same way that people here in our local communities are affected by it as well. So I appreciate you bringing that up.
Amen. Whoever said that, I'm on the mode where I can't see who's talking. So amen to you. Thank you.
And is there ways that we can help? Tomas, should we reach out to you or if
Yeah.
you want to have something to say about it?
I'll put, like I said, it's not like we're not like leading a coalition that has a plan on this. I can put my email in the chat. Once this bill is introduced, one thing I would start with is communicating with your senator that you might be supportive of this or some other, or any of these bills that you heard tonight. So this will go through the Senate first, so that would be the first set of targets. And so upon introduction, there was a little bit of media that Senator Mobley had when she first started talking about this a month ago. So I expect there may be a couple more media hits when it comes out, or I'll put thank you, Jordan, put my email in the chat. Reach out to me if you'd like to be involved. And then beyond that, we haven't, we're not the ones to ask necessarily in terms of what type of testimony would be helpful, but always letting our senators know or House reps know that we're expecting leadership is never a bad thing. So that would be all I've got for now, Jordan.
That's perfect. Thank you so much. Actually, that might be a great segue unless there's any other questions for Tomas.
I don't know who coined this, but flock off is basically my closing word. So we can all say that to our friends at Homeland Security. Flock the heck off.
I love it. Thank you. Yeah, awesome. So actually, that's a really great segue to just in thinking about what's important for us to remember about this legislative session is it's our house. The Colorado State Capitol is the place where legislation gets made for the state of Colorado, and it's our house. We pay their bills. We expect the best from them, and it is not always easy to show up down at the state capitol, but it is always an adventure. We do really encourage people to get connected with us if you'd like to go and do some testimony down at the Capitol. There are several different kinds of lobby days. I know there's an interfaith lobby day. There's a disability rights lobby day. I'm not sure if there will be a specific immigrant rights lobby day, but I would not be surprised if we did make that one happen. Yeah, please stay connected and do be involved. And honestly, one of the things I think is really interesting is there's a couple of different websites that actually that Harriet has shared with us recently on how to get in touch with your Colorado state legislators. If you're a little bit confused about who's your senator and who's your state representative, there's some great websites I can drop in the chat in a few moments to help people find those people. But they go to the same grocery stores that we do, the same coffee shops, the same tire shops, and wherever you see them, it is important to make a connection and share with them what you are interested in seeing happening at the Colorado State Capitol. Okay to ask them questions. They don't have a ton of staff, but they are responsible for hearing you out and your concerns. Yeah, does anyone who has been to the Colorado State Capitol and done testimony on a bill of any sort want to share a little bit about their experience? I know many of you have.
Jordan, I can speak.
Sure.
Hi, I'm Harriet, and I spoke on 276 last year, which probably was one of the bills that had the most people testifying. And I think I was there for the first round of testimony. And it really isn't that hard to do. Have your speech all typed out for you and go and do it. And you make your pitch. They call you, you've registered, they call you up and you give your pitch. And I think what's really important was for each of us to personalize why we were there and why that made a difference in our lives and in the lives. I mean, obviously, this was a bill on immigration, in the lives of the people that we're working with who are directly impacted folks. But it was really interesting to hear people from very different perspectives and life experiences sharing why they felt it was important. Some people were experts, some of us had relationships with immigrants and had worked with them in various capacities over the years. And yeah, it was very valuable. And one of the discouraging things was the senators on the committee would get up and leave the room for a period of time. But everything that we said was also recorded, so it was there as part of the testimony, and they are responsible for reviewing that. And certainly the people who remained for the course of the hearings definitely were paying attention, and you could see that they were reacting. So I would encourage others to do it as well.
Thank you, Harriet. Kathy, did you want to share a little bit too? Well, you're muted still.
I haven't had the opportunity to do any of that, and I'm just so glad for those of you that do it. I'm just here to be grateful to all of you. So yeah, kind of my real activist days kind of took a pretty big crash with my 80th birthday last summer. So I just can't do as much, but I keep informed and I talk to people, and that's what I do a lot of, so that people know what's going on. So that's my role.
Happy
That's what
you're on here, so you are still doing activism. So that counts for something. I just want you to know that there's different ways to be active. So thank you
Yeah,
for being on here.
it's absolutely. I count myself as being activist still, and I have to do it in a smaller ways. But I think everything any of us does is making a difference. And sometimes I'm just being a cheerleader.
absolutely, absolutely.
Sure.
Linda, what do
Yeah,
you want
I wanted your permission to put in the chat the handle for the flyer that my husband and I put together every week, because we put city council information on there for how to sign up. So, but I didn't want to just put it in. I wanted to.
Yes, go right ahead. Yeah.
Okay.
And Kathy.
Just a few things. Typically, no matter where I've testified, whether it be city council or water board or the state, I like to hand out one pagers that just summarize what I'm saying, so that we don't keep them on, and then they don't forget what I said. And then I just pass those out. When we're speaking in committee, you don't need that many copies because the committees are small, even at the state level. The second thing is, if you don't know the answer to a question, don't try and fake it. Just say, well, I don't know. I'll try to find out and get back to you. And then, in fact, follow through. And finally, I haven't quite figured this one out, and I don't want to keep us on overtime, but we can testify now on Zoom at the state level. And if anybody wants to talk to me later about how that works, great. Since I live in Denver and I can take the light rail in, it's kind of a no excuse to sit home on Zoom.
I love it. Thank you. All right.
I want to share one last thing from an accessibility standpoint for the state capitol. It's kind of weird, but they put these yellow jackets over all the parking meters that are near the building. And I don't know, like I had to address it with them when I would attend, because you don't always see somebody's disability. Like people are experiencing different health issues. And what I'm trying to say is if you have a Colorado handicap placard in your car, you can go up to the closed gate and just, they will open it up for you to be able to park much closer. Because I know that can be a challenge if you have to park far away and that's an issue for you. So
That is really good information to have. Thank you, Linda. Yeah. Yeah, so I guess I just want to say that really appreciate all of you being here tonight and learning as much as you did about everything that is moving forward at the state capitol. And just appreciate all of you. So would love to invite you to turn on your camera and wave goodnight to each other, and just share in a little bit of community. And a special, incredible shout out and thank you to Lamine and Nicole and Karina and Jenny and Tomas and everybody who shared tonight. So thank you all so much for all the work that you do. It's nice to see your face, Christina. All right. Thank you all so much for being here. Take care. Be well.